Very warm welcome to everybody attending, and especially warm welcome to Jules, Fran, Andy and Rachel. Really pleased to have you with us. Today we're focusing on age-appropriate care in care homes for people with young onset dementia. It's a really challenging topic, and one that we really need to get right, and needs a great deal of work. So I'm really looking forward to this the next hour. A reminder to everyone that you are not on audio and you're not on camera, but what we really are keen that you do is participate in the chat, of course, and then put your questions for the panel and we'll leave enough time for this. We'll put your questions in the Q&A function, and it'd be great to pick those up at 1:15. So without further ado, I think what I'm going to do is hand over to Jules, who's going to move to the next, start our webinar for us.
Hi, good afternoon, everybody. I'm just going to introduce a video that Andy and I recorded, just to give you some context and a little bit of history that predates the video. So Andy's wife, Tricia, is now 67 and she's living in a care home. Tricia was diagnosed with young onset Alzheimer's disease in 2022, and she deteriorated quite significantly, and Andy wasn't able to support her at home. Tricia was admitted under Section 2 of the Mental Health Act to their local mental health unit, and while she was there, that was changed to a Section 3. When Tricia was well enough for discharge, Andy felt that there was pressure on him from the hospital to find suitable care home accommodation. He expected to have support with finding a suitable care home, but he soon realised that he was on his own and that there was little support actually in finding an appropriate care home for Tricia's needs. Tricia was discharged into a care home, but it was clear early on that things were not going to work out, and the care home was not able to support Tricia in the way that she needed supporting as a younger person. Andy explained that the other residents in the care home were quite elderly, and there was very little meaningful engagement for Tricia, and she really struggled with being there. The care home placement actually ended when Tricia barricaded herself into her bedroom. She was very distressed. Andy at that point contacted social services for support, and on this occasion a social worker stepped in and supported the couple, and Andy is now going to share the positive experiences that he's had and is having with the second care home.
The lady from social services within 3 days had agreed that Tricia's got to be moved out of there and put into a proper nursing home, not just a care home.
Yeah.
I was contacted by Lancashire County Council, and they give me 6 homes to go and look at.
And any more advice other than here's 6 homes?
No, that was it. There was 6 homes that were willing to take Tricia.
Okay.
2 homes actually went to the care home to interview Tricia out of the 6. So the 4 that didn't go, I didn't even contemplate going to look at them myself.
Yeah.
The home where she's eventually moved to now were the first at the care home. They interviewed Tricia on her own without the care staff around, and they phoned me direct and asked me to go to the care home and look round.
Brilliant.
They were and they have been really supportive.
What things did you find supportive, Andy? I mean, it sounds brilliant that they contacted you and they were really proactive.
For Tricia as a person, knowing she's quiet, she's quite introvert, and she doesn't like anything new. She has to be kept busy. And what this care home do that she's in now, they have an amazing activities team. She's on the Dementia Plus ward. And through the week, they have experts that come in on from different fields to have the afternoon with them. whether it be music, singing, an art class. They bring animals in for them. And every week's varied, so there's no week the same. So she absolutely loves that. It keeps her happy. And it's helped her settle so much. She's not in a young carers ward. She's on with older people still, but she's settled because she's always being challenged and given different things to do, which I like, really, you know. So the care she's getting at the moment, it has a great effect on me, because when I'm not at the home now, I'm not worried about her.
So in the new care home, what did they do that was so different? I know they've got the activities, but what was different at the beginning?
They've got
Trisha first. They first assessed Trisha, and then Trisha moved. What was different?
Yeah, they assessed Trisha for an afternoon in the old care home. They invited me in on my own before I made a decision, to show me the home, showed me where the room that she would live, showed me the menus for the meals, showed me the activities, and you could see the activities. They were stuck on the wall, the paintings and the drawings that the ladies had done. And they let me join in some of the activities in the afternoon that were going on that day.
Excellent, Andy.
And
really good.
The residents that were in there were all laughing, joking, happy. And it just seemed a nice place to go. And it is. One thing very well that they do, once a month, they highlight one of the residents for one day. So all the staff will monitor Trisha on the 22nd of every month, which is her day. They monitor her. So they just watch her and they note down everything that they see or she does. On the 23rd, I go in and I sit down with the ward manager and we discuss what they found the day before. So I get a picture of where things are slipping in her journey. But also I get the comfort that they're watching, and if there are mental health issues or incontinence issues, X, Y, and Z, that they're on top of it and they're watching and they know what to watch for next on the next month. It's not that they don't watch them every day, but they really do concentrate one day a month on all the residents. You know,
It sounds like they've got a very big listening ear for you, so that when you do have something to say, they will hear it, even if it's something that's not so positive. It sounds like they'll work to make that not so positive thing a more positive thing.
Yeah, definitely.
That's really good to hear.
So thank you, Andy. Thank you so much for sharing your thoughts with Trisha and the care home. And Andy's going to be with us for the question and answer session at the end. So you'll have an opportunity to ask questions. So as Tessa said, please do put your questions in the chat and we'll answer them, hopefully answer them at the end of the session. So from Andy, and certainly from experience in working with families, we know that the transition into a care home for the person living with young onset dementia is particularly challenging. It's particularly fraught. And we know that there are very few places that offer specialist support to ensure successful placements. Andy has shared with us that Trisha is now in a care home. It's not a young onset care home. It's an all-age care home. And it's been a very successful placement. So we will be looking at some of those reasons why during this session. And as I say, you can also ask us questions and Andy questions at the end. So just to go over a few the usual things that we do at the start of these sessions is what is young onset dementia? And essentially young onset dementia is considered when symptoms start before the age of 65. We know that people living with young onset dementia
tend to be disproportionately affected by rarer dementias, so between 5 and 15% of people. So you're likely to see more unusual symptoms. And in the UK, we know that there's around 70,800 people living with young onset dementia. That's about 7.5% of the total number of people living with dementia as a whole. In terms of what we know about care homes and supported living and young onset dementia, we actually don't have any figures for the number of people living with young onset dementia in care homes. We also know of the thousands of care homes listed on the CQC website. There are only, I think it's about 30 that are listed with a young onset dementia specialism. And actually, from experience, I know it's really difficult to find those care homes, to actually filter for young onset care homes. It's really, really challenging. And it's one of the questions that I'm asked about most frequently. And we also know that there's a severe shortage of appropriate alternatives for people to live at home. The other thing that's really interesting is that younger people with dementia are cared for at home much longer than those with late onset dementia, almost 9 years as compared to 4 years. So we know that the families affected by young onset dementia really feel the strain, are very distressed, and often at the time that somebody is going into or transitioning into full-time care, it's really, really difficult for the family. I'm now going to hand you over to Fran, who's going to talk about her research. You're on mute, Fran.
So my name is Fran, and I work in Oxfordshire, and that's why we've got some statistics for Oxfordshire. And we have about 5,500 people living with dementia in Oxfordshire, and of those, about 413 are young people with dementia. Next one, please, Jules. So I carried out a research which I really need to share, and the research was looking into the experiences of spouses of people that have moved from a hospital to a care home in UK. And the difficulties that were identified immediately were that it was a different stage of life. There's different impact, and the issues are also different, because this is an age where people are still making a lot of plans, and they still have a lot of things to achieve in their lives. And one thing that was very obvious is the variation in services around the country, and at times just between two counties that are next to each other. Next one, please. So these are some of the lived experiences. Of course, they are just a summary because it's a lot of information, and this is the results from the research. Lack of guidance of families, which we heard from Andy as well. So they were just given names of care homes, but there was no guidance as to what are they going to look for, or what questions to ask, and what else is known about that home. Professionals, actually, some of them didn't know the homes themselves. They just literally picked the names of the care homes and gave them to the spouses. And so, of course, the sparsity of the care homes themselves nationally, there's very few. We've heard of about 30 from Jules. And when available, they could be very far from home. For example, now we know that in Oxfordshire, there's none. If we have to look for a care home, these people have to travel long distances, and that's not appropriate. And then the lack of the specialism itself. So even the one that went into a care home that had was for younger people, they still struggled with the specialism that's needed for this age group. Next one, please, Jules. And I just thought to share some of the words that these people said, which really had an impact on how I think now about care homes. For example, this lady who visited, Alana, who visited 4 care homes, and she said she experienced a lot of shocks along the way. She also shared the same views with Ellen, who visited 50 care homes, many of those being specialists in dementia, but actually the specialism was lacking, and some of them were quite far away from home. Next one, please. And a lot of the places wouldn't take him just because he was under 65. He was below 60 at that time. And that was just and no, we can't even have him because he's under 65. And there just was not the facilities for a younger person. That's what she experienced, which was also shared by the rest of the other people. And everything in the care home seemed geared towards the care of the older person. And so the younger person was always at a disadvantage. And the general consensus, which was sort of summarized by Thomas, was that there is care homes for older people, and his wife is young. And where will she live? Because she can't live at home now. And when he walked into that care home, each time he went in, he always thought, we are living separate lives, but we are not divorced. And yet I don't have the space to be with my wife in the way I should be with a wife. And next one, please. And the other thing I just needed to share was that the real life outcomes, which are really negative for these families that are younger. And I can give you examples of, for example, Ellen, the second one, lady here. Ellen's husband was in hospital, admitted into hospital, discharged to a care home that wouldn't work, that couldn't meet his needs, and he was readmitted into hospital. At the time of the interview, he was in a second care home, which was sort of stable at the time, but she was very worried about if this fails, where next? And I can also give you an example of Maxwell here. Maxwell's wife was admitted into hospital, discharged to a care home, and stayed in the care home for about 2 months, and that broke down quite quickly. And so she had to urgently be moved to another care home where she stayed about 2 weeks. And then that didn't work, so she had to go back into hospital. So within a year, she had moved 4 places, and they were now looking for another one. And at the time of the interview, the place that she had been recommended, none of the professionals had been there. None of the professionals knew that place. And he was very worried because he was being told about a place that none of us knew, none of professionals knew about. How would he trust that his wife would be safe in that place, that these people would actually care for his wife well? Next one, please. And some of the points, this is just a summary of some of the points that were raised. What a homely care home might look like. Homes that meet the needs, including religious needs. One of the spouses, one of the families was a Muslim family, practicing family, and they found it very difficult in the care home, despite they were trying to they'd given all the support of his iPad so he could still hear his Quran, he could still hear the music that he knows, the language that he knows, and that didn't work. Homes that respect that people are sexual beings and the private is considered. Spaces for meaningful activities such as walking, gyms. The Maxwell's wife he described as a gym fanatic, somebody who liked exercise, and she couldn't do that. Homes that allow children to visit. For example, Ellen, who visited 50 care homes, she was going around with her 18 to 19-year-old daughter. And that might just be why this didn't work at all. Because each time got somewhere, she would just get distracted by what she saw and thought that can't fit in here. Next one, please. As a result of this research, myself and another colleague from Dementia UK got to come up with a leaflet that gives some guidance on what you can look for in a care home, the questions that you can ask. And hopefully that might be helpful and give some guidance. And so that's now available, and you can get this from the Dementia UK website. I'll hand over to Jules now.
Thanks, Fran. Sorry, the slides were jumping around. I'm not sure if it's just on my screen or whether it's been affecting you as a whole. Hopefully it won't put you off too much. So for my section of the presentation, I'm going to talk about a case study. So the case study is based on a true story. I've got permission to share the story. The photograph that you see isn't of the couple, it's just in there, just to give you an idea of the age of the couple, really. So I'm the consultant Admiral nurse for young onset dementia, and in my role, I support families clinically between 20 and 40% of my time. And I accept referrals from the Dementia UK helpline and from our clinic's Admiral nurses. So Gemma is the lady who phoned the helpline, and she wanted some advice and support for her husband. Her husband was in a care home, and she felt that no one was coordinating her husband's care. She felt that he was very distressed. When she spoke to my colleague on the helpline, Gemma was actually very distressed herself because she just thought that no one was interested in her husband or how she could support him going forward. She just didn't know what to do or where to go. So Gemma was referred for some additional support from myself. And just to give you a little bit of background, Gemma is happily married to Phil. They've got 2 adult children. And Phil was diagnosed with young onset Alzheimer's disease at the age of 55. He's now 65, and he's been a resident in the care home for the past 6 years. So Gemma described Phil as being in the late stages of dementia. As I said, she felt that he was distressed, and a statement that actually really stuck with me. She said, it's been really hard to witness this level of suffering in her husband. She was, as I say, desperate for support herself so that she could support him. So Gemma felt that the care home staff and the GP were not listening to her. She'd asked for help. She'd asked for her husband to be referred on to mental health, to other services for review, but she really felt that she was hitting a brick wall. She was told that her husband's symptoms were normal for dementia, and actually the emphasis was on, especially for a younger person with dementia. So it was to be expected, according to the professionals working with her husband, that he would be distressed. And Gemma just felt that this didn't sit particularly right with her, hence contacting the helpline. So when I worked with Gemma, we worked on the phone. She had the opportunity to choose either a phone call or a video call. She wanted a phone call. And when she spoke to me, it was on a Wednesday afternoon, always a Wednesday afternoon. She worked full time. Gemma was actually, and is actually, an OT. She works in the NHS, and she compressed her hours so that she could have every Friday afternoon with Phil in the care home. So that's when we had the opportunity to speak to each other. So although I never saw Phil, I actually heard him, and I heard how Gemma engaged with Phil through the telephone calls. So we did look at Phil's symptoms quite holistically, and we thought that he had pain that hadn't been recognised or treated appropriately. Initially, Gemma was quite reluctant to think that this was an issue because Phil had been prescribed regular pain relief. So she didn't think that pain was an issue. She thought there were other things happening with Phil that hadn't been recognised. We also looked at how Phil could be supported and engaged physically and emotionally. And we looked at Namaste Care, in particular, kind of looking at the holistic ways of supporting people who are coming towards end of life with their dementia. We also looked at Gemma's emotional and psychological needs. She actually said to me, I've never been heard or supported before. She was actually really tearful that she had the opportunity to speak to a professional that understood dementia, and that she was actually able to share what was happening with her and her husband. And we also looked at researching local services in the area where Phil was living, in the area of the care home. And although it was a difficult conversation, because, as I say, I spoke to Gemma on the phone, I never actually saw Phil. I wasn't able to read Phil's notes because it was telephone conversations that we were having. From what she was describing, although Phil wasn't at end of life, he certainly, as she said, was in later stages of dementia. And we felt that the palliative care team, the local palliative care team, would be able to input and hopefully support Phil in being more comfortable. One of the things that we did discover along the way, as I said, Gemma didn't think that Phil was in pain. Gemma actually spoke to the nurses on the unit, and she went through Phil's records and she looked at his prescriptions, and she realised that although Phil had actually been written up and prescribed regular pain relief, he actually very rarely had it. So it's one of the things that we asked the GP to review. Gemma spoke with the GP and asked for Phil to have more regular pain relief, and also to look at potentially having something like a pain patch, which is a bit like one of the smoking cessation patches. It's something you put on your skin and it will release over 24 hours pain relief. So that's something that Phil had, and I have to say it worked exceptionally well once he had that regularly. In terms of outcomes for the couple, Gemma expressed that she felt very grateful that she had been heard and supported. She felt that she'd been really, really listened to. We spoke a lot about how she could engage with the staff at the care home, so open up those lines of communication as well. And really, I think because of Gemma's role as being an occupational therapist and OT, she actually put a lot of effort into engaging with the staff and teaching them the things that she had learned through our conversations. So she actively spoke to them about pain and recognising pain in people with dementia. She then spoke about Namaste Care and what she'd read around Namaste Care and how she was using that with Phil, and the care home became very interested in that. The palliative care team did become involved. As I mentioned, Phil wasn't at end of life by any means, but the palliative care team were able to recommend medications to support Phil and being in pain, and support the GP with that as well. They also were able to refer Gemma for some bereavement counselling, so she was able to access that on a longer term basis. Phil, in the longer term, was much less distressed. One of the things in terms of Namaste Care for Phil was that he was very much isolated in his room, and with the support of having the Namaste Care, also the pain relief, and working with the care home, Phil was brought back into the care home, into the social environment, and that made a real difference for Phil and for Gemma. The other thing was, which I think Fran touched on, was allowing Gemma and Phil time alone in their room, allowing Gemma to be with Phil on the bed as well, so that she could lay with her husband and, cuddle with her husband, support on her husband. The outcome was that Gemma said that she doesn't feel isolated and alone anymore. She understands that she can contact the Admiral helpline if she needs support in the future. And as I say, she's also got her bereavement counselling. Outcomes for the care home, touched on that briefly, but the care home now have a really good understanding of Phil and the pain that he's experienced, and hopefully they can translate that and support other residents in the care home. They also work really hard at looking at age appropriate support, so bringing in music, social activities that would be appropriate for Phil and Gemma. They learnt about Namaste Care. Gemma was very active in taking that forward. And the care home also developed really good connections with the palliative care team, which is something that they didn't have before. One of the other things is that the care home had a really good idea of recognising distressed behaviour, not putting it down to just dementia, and not saying it's just because of somebody's age that they're more distressed. So there was a really positive overall outcome. So I'm going to hand over to Rachel now, and Rachel's going to talk about the development of her young onset unit and also how she supports people living with young onset dementia. So hopefully you're there, Rachel.
I'm here. Hi, thanks, Jules. Thanks for having me. Great to be able to have this platform to really talk about young onset. It's so very vital. My name's Rachel Beckett. We have 14 care homes across the North East and Yorkshire, and we now have 2 dedicated services for young onset dementia. Next slide, please. So, how was the manor born? On to the next slide. It was a conversation pre-COVID that I had with a wonderful lady called Jill Quinn from Dementia Forward. Some of you may well know. She has a fantastic team, and they've worked tirelessly to raise awareness for young onset. And I was absolutely taken aback when she told me the numbers of people that they had on their books of people with young onset dementia. Next slide, please. So the conversation started at a time when I was looking at one of our homes in York and turning that into a dedicated dementia service. Jill was describing to me what was needed for people of this age bracket, a very home from home feeling, a very like a house feeling. And when I looked at the plans of that home, there was a section of it that was an old vicarage, and it very much lent itself to exactly that. So we took the plunge. We took more conversations. Obviously, COVID was in the middle of that, so it took a lot longer for us to actually finish and build it. But as soon as we opened our doors, the amount of inquiries that we were getting was mind-blowing, and how little dedicated support and care and awareness that there was for those living with young onset dementia was very clear to us. The next slide, please. So how did we develop? We very much stepped out of our comfort zone because this is a completely different age bracket, and we totally understand that their needs are. We have elderly care facilities, and we have had a few people in our homes that have been much younger, and we've seen the deterioration in that environment because they're so much more physically able to do things that we can't always provide in a residential care home for the elderly. We didn't have any reference point for what we launched, which was the manor, and there was no real strong competitive analysis, so we had to work very closely with the families, with the likes of Jill Quinn and the local charities in our area to really understand what the needs were and how we were going to dedicate this home in particular to young onset. So everything that we've done has evolved. We've involved all of the professionals in our areas. We're listening, we're trying to understand as we go. But as we opened our doors, within 6 to 7 months, we were full. And we didn't want to start turning people away. So we immediately launched another service. Next slide, please. The whole project has always been my passion and my team's passion to really make a difference in people's lives. That's what we do as care home providers. And the shocking numbers of people with the young onset, I just couldn't sit back and not do something. So having the manor and providing that home that offered support and understanding for the age appropriate care. You've talked about young families. It's very much the case. Partners that are still working, the need for them to be able to get on with their lives and be able to provide and earn and look after the children, knowing that their partner is in an age appropriate setting. There are very many different aspects to that, not just from the physical aspects, but that they're not in an elderly service where they're surrounded by elderly people. They're around people that are like-minded, similar age brackets. We're very family friendly. There's lots of children that come and go from our manor services, and we very much depend on those links with the families. Next slide, please. So what are the challenges that we have faced? There are many. Next slide, please. It's really about reaching the people that need it most and about raising the awareness, because there are some people that are really working hard to do that, but there's just not enough. I get a lot of calls from other providers that are very keen to start providing a service like this, but they need to understand more. And that's where we need to really start shouting about it. We need to start forging new relationships nationwide with charities, social teams, and other key players in the care sector. We need to amplify the voices of those living with diagnosis who are often not being heard. People like Andy, we have an amazing chap in Northumberland called Dougie, and listening to the stories of what people have been through and why, and the system not working for them, and the time that it's taking between diagnosis and the care that they so urgently need is actually extremely shocking. We need to start raising as much awareness as we can. Next slide, please. So again, talking about the awareness, but also it's been very challenging getting all of the teams in all of the areas to really understand what we're trying to do here. And what we've done as part of our journey at the manor is to create an external path where we have people from charities, GPs, mental health teams, social teams, everybody in a room to be able to say, this is what's happening. These are the stages of development, medication, making sure that that is so quickly. We've had situations where the meds teams haven't been able to react to the mental health advice as fast as is necessary. So we now have our mental health team come around once a month. They're constantly doing updates and analysis. We have a great relationship now, but it's about really spreading that into all of the other boroughs that people are in and care services are in. We need to start red flagging these situations so that the time that is taking to get the support is reduced and action is taken faster. Next slide, please. So for the numbers that we know, the urgent need for dedicated age-appropriate care is there. But for us to provide it, the single biggest problem we are facing is reaching the people to let them know we are here. Next slide, please. So we're encouraging and facilitating conversations, as I said, with key professionals across the spectrum. We're creating clear messages and regular communication tools, such as standalone website, newsletter sign-ups. And we have a brand new young onset dementia awareness campaign. Next slide, please. Our brand new awareness campaign, it's not a sales tool. It's our hope that it can act as a catalyst to spark conversation, awareness and understanding, and helping to inspire empathy and encourage action. Next slide, please. Our new campaign video highlights the impact that young onset dementia can have on family and friends. Our campaign aims to raise awareness, understanding, and to reach those that need it the most, and to let them know that there's somebody there that understands what they're going through and that we're there for them every step of the way. Next slide, please. So we've created a video. It's called It's Going to Be Okay, Mum. It's a very heartfelt video. And the purpose of this, like I said, is to really raise awareness, to help transform the lives of those that need it. We have noticed in a short period of time that people are in our services dedicated for young onset, the difference that it's making to their lives, but to their families' lives and to their children's lives is absolutely remarkable. In just 2 weeks, the difference has been incredible. We have case studies that I've been sharing with Care England, and Martin Green and his team are very much supporting everything that people are doing with young onset and supporting our campaign here. We need to make sure that we use this platform, and other platforms are out there, to work together so that we can all make a difference, and that if we can watch our video, share it, like it, get people on board, tag people in that you know need that support. We're here about collaborating resources so that there's always somebody at the end of the phone, no matter what your situation, no matter whether it's a legal situation, just somebody to talk to. But that's what we're here to do as Wellburn, but also very much integrated into all of our community groups and all the charities that are working tirelessly to support those people too. So please go on to dementia -wellburncare.co.uk. You can see the video from there, or we'll be sharing the QR code within the chat conversation. Thank you very much.
Thank you very much, Rachel, Jules, Fran, and Andy's going to appear shortly, I hope. Lots of really useful information there in terms of what works for people with young onset and their families. And what we're going to be looking at now is picking up on the questions. There's been ever such a lot of good exchanges within the chat as well. Let me go first to the questions, though, just so that we make sure we have time for those. So who provided the information? This is going back to the beginning and Andy's experience, really. Who provided the information for the 6 care homes for Andy to visit?
It was Lancashire County Council. They have a team that put out Trisha's information to all care homes, and care homes that are interested in taking her then feedback to them, and they just give me the list and ask me to go and visit and to see how close they were to Trisha's needs on my own.
Yeah. And I think you mentioned that 2 responded, and that you followed up 2, which was you took it to be a good sign that they responded, and I think they met Trisha, didn't they?
Yes, absolutely. They took an interest in her straight away, which immediately to me said that the care.
There was a good chance that the care was going to come through as appropriate for Trisha, but also for you both, really.
Yes, yeah. I mean, they do take an active participation in my well-being as well. They hold monthly meetings with all residents, families, and relations to get feedback on the home, but also through the resident psychologist, who specifically just speaks to the relatives on how we're doing.
Yeah, yeah.
And they bring experts in for that. This week on Thursday, we're going to be speaking to 2 solicitors on power of attorney and all that kind of thing. So it's really good all round. It's a good service for me as well as
practical. Yeah.
Yeah.
I guess this is a not so much perhaps a question as a sort of plea, really, in some respects. How can you put a 44-year-old with young onset dementia into a care home? You do have to have the right place, the right support, the right care, right people. Any other? Do you want to throw in anything else into that conversation?
I think. Oh, sorry. For me, when you're looking at a care home, you must take it as read that the medication and the medical side of the care is going to be there. For a younger person to go into a care home, it's much more about other parts and aspects of their activities, whether they've got one-to-one, whether they can buddy up with nurses and carers, all that kind of thing is really important for young people. Yeah,
that's true, Andy. Rachel.
Yes, so we have in our one of our homes in the northeast in Gateshead, we have a young gentleman who's 45, and it's all about what they do in their day and about their physical abilities. And he loves running, he loves cycling. We have an exercise bike now in the home. He's just so fit and able to do so much more. And if he sat in an elderly service, whilst we do trips out and we do a lot of activities in all of our homes, it's just not enough. They need the freedom to be able to live like they live at home. We have open kitchens. They can go in and make pancakes or whatever they want to do, have a glass of wine. It's very much like home. And like I said, a very family driven environment. And for us, that is the difference that we've really noticed in this particular age bracket. And the relief that we've had and the case studies that we've been able to develop just off the short time in the last couple of years that we've been doing it is absolutely incredible. And the family's relief and knowing that they have all of those different things covered for them. So yeah, the youngest we have at the moment is 45, but we have been speaking to people younger than that as well. So
thank you. This is a comment again, really, from Tony. Care homes are not geared up for young onset dementia. Sadly, that's only too true for the majority. So we run group activities to support them in the community. My wife was 53 when she started developing young onset dementia. So that's drawing in local community, and that's really important too, because care homes can have really strong connections actually with local community, and that offers more enrichment, in that respect as well. And it's also normalizes life to a degree as well, doesn't it? Being able to connect in and out, and that doesn't suit everybody, of course, but it is possible to connect in with local. Do you, this is one for Jules, do you accept referrals from people living anywhere in the country? This person's in Wales.
So all the referrals I am the Young Onset Admiral Nurse Service within Dementia UK. So it is just me. In terms of how I accept referrals, they come through our helpline, our Dementia UK Admiral Nurse helpline, or our clinic appointments. So everyone would contact the helpline or have a clinic appointment, and then the nurses who are taking those calls, if they feel it's appropriate, they would then refer on to me, and I support people. I either offer a one-off appointment, or sometimes it might be several. It depends on need, but as you can imagine, it's quite a limited service. We're hoping to expand it, but it is quite limited. So if you need support, I would say for the first instance, contact the helpline or make a clinic appointment, which you can do online via the Dementia UK website.
Thank you. I think it's another one for you, Jules. Where can we as professionals access Namaste holistic care training?
I will send out a link. Actually, there's a book, a really good Namaste book. In terms of training, I did my training actually at St Joseph's Hospice in London. I'd have to research whether they're still actually doing that, but I'll certainly have a look and we can maybe send that out. But it's brilliant training, absolutely brilliant training.
Thank you. Question for Rachel. I think expansion is in people's minds, and they're thinking about the south of England. Any plans to move south?
No plans at the moment, because our company is really based in the northeast, and operationally that's where we are. But I am really strongly encouraging other providers to follow us. And I know some of the hard work that we've achieved through York, and that has been breaking boundaries with the local authorities. You know, it's been a long journey getting everybody on the same page, and that includes the funding element of it. And we're going through the same process in Gateshead, which sits in 8 different boroughs as well. So we're in a catchment for 8 different local authorities. And those conversations are key to making people understand that it is their choice. It is in their best interests of their loved one to have the right care delivered for them, whether that's a home for life or for a period of time. Because the biggest, like I said, the biggest thing that we like to do is make a difference in people's lives. That's what we are all about. But there is also people that you need to be on board with all of that. And, you know, seeing the difference, come to the service, see the difference that it makes. As for moving south, I'm on the board of Care England. I talk to Martin about this on a regular basis. We are already having other providers that are wanting to talk to us from all over the UK. And I know there are some great community stuff going on as well, but it's about having those places for respite and for the care for this age bracket. So I am pushing it, and I will continue to push it. But unfortunately, no Wellburn young accept facilities in the south at the moment.
No, okay, thank you. For those, don't know if you can help with this, Jules. For those people who need to have support and accommodation, long-term care, but they don't have a specific young onset specialist home near them, which, as we say, is the majority. Can you tell us a couple of things that would be 2 or 3 things that would be absolutely essential from what you've understood through the people that you've supported over the years? What would be essential in terms of the in terms of making sure that those people have a good experience in the care home?
I think this is probably a hard one, but actually to start early, to start looking in your local area very early on, before you even need full-time care. Making connections, I think, with the local care homes can be really supportive in the long term. Certainly with families that I've worked with, I've always encouraged them, because it could often be difficult to get things like day respite as well. So I've often encouraged them to make connections with care homes to see whether they can access day respite, if that's something that could be provided.
Yeah.
To get to know the care homes, to look round. I think Andy mentioned when he visited the second care home, the care home where Tricia is now, the difference that he noticed was that there was social activities, there was laughter, that he was joining in. It's about getting a sense of what the care home's like in terms of the support that they offer. It's going to be really difficult to find a young onset unit, as we said at the beginning. It's really challenging. You can't look on the CQC website and find care homes. It's really hard to do that. So I would say investigate your local area, get to know the care homes, get to know the care homes that you really like, that you get a sense of, that you really connect and gel with them, develop a relationship, develop a care package with them. It might be, as I say, that you have daycare, and you'll get a sense of how they can support your relative going forward. That would be, I think, one bit of advice. And it's not easy. I would suggest, call the helpline if you need support around that.
Okay,
and we can provide information.
Good call, Fran.
Just along the same lines as Jules. So we're really encouraging families to go for the community days when the care homes have open days. Go in and have a cup of tea and cake and just see what the care home is like, and visit as many as possible when they have activities going, because then you get to have an idea of what happens in a care home, how they work, and some of the stuff you can actually form relationships with them, because that's helpful instead of waiting for a crisis to happen.
Yeah.
Because if a crisis happens and it's got to be done now, it's very distressing.
Yes,
so
all done in a panic.
even if you don't use it later in future, that's fine.
Yes, okay. Thanks for that, Fran. A brief from Rachel, and then I'm going to move on.
Sorry, just very quickly about the funding and the element about that. When you look at what's happening in terms of hospital admissions, care home, another hospital admission, another care home, all of that process is costing the whole system a lot of money. And unfortunately, a lot of people, we've witnessed it on numerous occasions, are getting sectioned, and the costs of sectioning are astronomical. And we can avoid that. We really can avoid that. And that's what we need to do. And that's where you press back on the funding teams and you say, this is not cost effective. We need more support, and we need a dedicated young onset support. Okay.
Yeah. Thank you. Question from Julie. Most homes say they don't accept under 65s, and she's wondering whether that can be challenged. And if so, how? Anyone respond on that? Rachel?
Yes, you have to register your services to be able to take people under 65, and that's the process you need to go down with CQC and the local teams. So it can be done, but it really depends on how you're going to use that facility. For us, it's a separate part of the building. It's the wing. It's not part of the elderly care service. So that's how it's worked for us, but it's still under the same CQC registration. But it's a part of the home that is dedicated purely to those with young onset. So that's it can be done, but it's just
it can be done, and there needs to be a willingness to do that and go through the process.
In fact, a lot of providers don't do it because of the funding, the lack of funding.
Yeah. Thank you for responding on that, Fran.
And I was just going to say, if they're saying they don't take this age group, it might mean that they know they don't have the skill set.
Okay.
So it's better not to argue. If they can't meet the needs, then they can't meet the needs.
Yes, okay. That's a very good point. I'm going to move to another question. Are there specific houses or facilities for young people with a diagnosis of young onset dementia who don't want to enter a care home model and do have capacity to make that decision? And anyone, any thoughts on that? Rachel?
It's something that we would like to look into ourselves, because we feel at certain stages they love the family element. We own the biggest facility we have is 7 bedrooms. We have a 7, a 4, actually no, sorry, 8, 7 and a 4. And sometimes we find at later stages they need that quiet space. So what we're looking at moving forwards is developing 1 and maybe 2 bedroom apartments that we can cater for people that would wish that. And I think there is a real big calling for it. But as you can see, the numbers, 70,000, it's not a lot. Just what we're doing is just a drop in the ocean. So we've got to get other people doing it. And yes, yeah, I'm sure there'll be numerous providers out there that would consider doing that. Just got to get the funding element sorted.
Thank you. Yes, I know that there are some supported living accommodation. There are or were some terraced houses supporting people with young onset dementia, small family home type accommodation connected to a nursing home, but separate from it in terms of the living arrangements. So, but whether those are still available or whether they've flourished, whether there's more of those, I don't know. Anyone? Does anyone? Jules?
I've worked with some families, particularly recently, actually, where social workers have looked into learning disability environments. They've really struggled to find any suitable care homes locally within an hour and a half, and then they've started to look at learning disability services, interestingly.
Yeah. Thank you. Fran?
And in Oxfordshire, we've got some called ECH, so that's assisted living. Can't remember what the ECH stands for. So we do have some clients in those accommodations, but they also seem to have issues because they are open and they're supposed to be independent and plan some of their own activities. And so that brings a lot of difficulties at times, but they are available.
Yes. Okay. Yes. Thank you. What key skills do your staff team have at the Manor, Rachel, that makes such a difference in terms of providing the specialist care for people with young onset dementia?
Sorry, I was on mute. The skills sets are very, very similar. It's just much more active. They're out and about more. They're driving out, they're going to places, they are thinking on their feet in terms of activities. They are highly trained in de-escalation, because a lot of people can get very frustrated, but they're more physically able. So it's just, how do you deal with those frustrations when they're more physically able, and how do you guide them and nurture them and encourage those situations to de-escalate? So everybody that works in our 2 manors also works within our elderly care facilities. So they have an understanding of both different age brackets. And I just wanted to answer a quick question about somebody who's put on there about, once they reach 65, do they need to leave? No, that's not the case. We've got a lovely lady celebrating her 70th birthday in the Manor in York. So that's not the case. The diagnosis is young onset, and that's how it works.
Thank you. We are unfortunately out of time. So I'm going to thank Andy, Jules, Rachel and Fran very much for your participation in this webinar, and thank you to all the attendees. The lookout for 11th of March, advanced care planning for people with young onset dementia. We've got Chris Roberts and we've got Jane Goodrick, who are going to talk through their personal experience of developing their own advanced care plan, looking at the challenges, looking at the importance of doing so. And I would suggest that I think we will put the link to the webinar in March in the follow-up email. So do register for it, advanced care planning, and that's a collaboration with the Dutch Young Onset Dementia Knowledge Centre. look out for that. That'll come to you in the next couple of days or so, and we'll make sure all the links and the presentation and the recording and everything are in there. But other than that, I'm going to say thank you very much for a very informative session on a particularly sensitive and quite challenging topic. So thank you.